Well, good morning again. My name is Dr. Melissa Stewart, and I wanted to continue the conversation I started in the last vlog about the questions that particular client had asked me about how to improve patient experience, particularly with provider interaction. So today I want to spend a little bit of time with electronic health record. I think that's an important discussion and is a clear impediment for many physicians to make that connection with the patient. So this was the second question, or the third question this particular client asked me, is how do we deal with that and how do you make that better? In my experience, physicians that already had great communication skills, they weren't impacted much with the introduction of electronic health record. They seemed to take it in stride and do very well with it. Physicians that didn't have high patient satisfaction scores initially, adding this piece of equipment or this particular instrument to that patient interaction caused a lot more trouble for them, and they really struggled, and many of them, their scores decreased as a result of it. So how do you handle the electronic health record while you're interacting with a patient? Well, there's several ways to do this. First of all, I would recommend that the physician or the provider not take too many notes. Essentially, what you want to do is get down enough information so that you can complete the note pretty quickly following the visit, perhaps before you go in and see the next patient. But you want to get down at least enough information so that you won't forget what that interaction was about. As you enter the room with your laptop, or if you have a computer in the room, for the first 20 seconds or so, ignore it. Look at the patient, talk to the patient, look in their eyes, and then ask permission to enter the information into the computer. Patients at this point are fairly accustomed to the electronic health record and they're comfortable with it. Include them in that interaction as well. Show them the screen. I know pediatricians do this all the time because now they can show the growth charts right on the screen. But many of you can do that as well. Turn the laptop towards them or your computer screen towards them, and as you verify the pharmacy to send a prescription or whatever that you want to share with them. This is a great way to include them in the discussion and to increase that connection with the patient. If a patient asks you questions while you're typing information, stop. Stop typing, look at the patient, answer their question, then go back to typing. Too often when I'm in an exam room with a patient and a provider, the patient is staring at the back of the physician's head as they're just typing away. This does not make a connection with the patient, and the patient will not score you high. So make some notes. Do not access that electronic health record for the first 20 seconds or so when you're in with the patient. If the patient asks you a question or starts talking while you're entering the data, stop typing, look at them, answer their questions, and then you can resume. So don't let that particular electronic health record impede your ability to interact with the patient. It really should be helpful to you. The other piece of this is before you go into the exam room, look at that health record. Make sure you know what's in it. So that way you can start the conversation rather easily with the patient because you'll have that background information and they know you care and you know about them. So point something out from their health record, either if you've seen them before or another provider has seen them before, so they're confident that you know who they are and that you're addressing their particular issues. I hope this is helpful for you as you go forward with your interactions with the electronic health record and your patients. It really is a matter of making that connection and maintaining that connection throughout the entire visit. And our next time together, I want to discuss the next thing that this particular client asked me about what's another challenge with that patient interaction. I think you'll find this one rather fascinating. Until then, have a great day and certainly share this information with your physicians and providers. Thank you. Bye now.